Thank you. Ndani kuna Uhuru hapa tafadhali, wako tayari, wamekuwa kufanya kazi nzuri sana. Tunashukuru. Tuendelee, ni nyingi, kaunti imejitayarisha. Thank you very much. Piga makofi tafadhali, tuendelee kupiga makofi. Wanafanya kazi nzuri sana. Na tukumbuke hizo ambazo tumepewa. Sisi wote kama tumepigwa chanjo.
It is important that we work towards vaccine equity. We have to rebalance the equation. We know we have surpluses in many countries. We want to appreciate and acknowledge the donations that have already come to Kenya. But there's a lot more that can be done at the global level, and we really urge other governments, please, let us all be in this together as part of a global community combating COVID-19. Kenya already has 6.5 million vaccines here. More are coming, and even more will be coming. And so this is the time, it's really important that we use the vaccines on time, that we get the vaccines to the people who need it the most vulnerable at the moment, and that we keep this going. We don't have a lull, that we need to keep this intensification. So with that, just to say that as UNICEF now specifically, we will continue to support bringing more vaccines into the country. We will continue to support the cold chain capacity in this country, looking at communication, risk communication, but also dispelling all the false communication that there is around this. Please help us. Please get the right information about COVID-19. Please get the right information about vaccines and vaccination. Don't be part of the misinformation and disinformation. Be part of the correct information and come together and help the Ministry of Health and the leadership of the country to actually achieve its goal.
Month of July and I think September, the infections have been quite high. And actually, as a church, let me say the church because that's where I know. I'm not quite sure about the Muslim fraternity, but I know in the Christian fraternity, we have lost very many bishops. And we would want to see that coming to an end. We don't want to speculate on why, but we've lost quite a number of bishops. Continue to just follow on the protocols, but most importantly, in the places of worship, let's not have this thing of faith will guard us. Yes, faith does guard us, but let's wash our hands, let's sanitize, Let's do the social distance and all the things that we started doing so that we can be able to make it to the other side. So we would want to see how we can shorten that between death and burial. And then at the same time, we know Kenyans wako na roho ya generosity. Let us not give food during funerals, during burial services. Wacha watu waende nyumbani, wakule nyumbani, because that's where they ate yesterday.
We have so far vaccinated 256,000 people. If you work out the percentage out of those who are eligible for vaccination, that works out to be only 18%. And that is not good enough. It is not good enough for a county where we know families that have almost been wiped out. People we knew who were clergymen who've lost their lives. So I wouldn't say that 18% is anything to be proud about. And that is why in our discussion, and we knew that you wanted to do this mass, to flag off this mass vaccination campaign, we requested that you do it here in Kiambu. We've also, because let us speak the truth, since the rate started coming down, we've also started to notice some apathy on some people, and particularly the younger people. What we want to do, yes, we want to continue to tell them that the danger is still there, because as Dr. Murega said, we've already seen four waves. We don't know how the fifth one will be like. At least we know we have gone to the four of them. We don't know how the fifth one will be. And therefore, the most important thing is for us to prepare. So we want to come where you are. Vaccinated over 3,000 people within a very short period of time. So we want to come to where you are. We want to target to be vaccinating 5,000 people per day. We are doing almost half of that. We want to increase the number of people. And the beauty is that people are now calling me and asking me if I can take the vaccine to where they are. So we will come to you and we will go to places where you will be asking us to come. Because what we want to do, Aziri, is to open up our economy. We no longer want to think about living without COVID, or what we used to call post-COVID. There's nothing like post-COVID. It is now how we live with COVID. They would want us to keep on observing. I normally now have seen that people have started shaking hands. Please don't. We haven't died for the last almost 2 years because of not shaking hands, so we shall not die. So some of those habits, I think we can keep them off. Suffering from non-communicable diseases. These are diseases like diabetes, hypertension. Those are older people. And those are people who will be walking many kilometers, because our level 2 and level 3 may not have those drugs. So they would be coming to the level 5 hospital or to level 6 in Tigoni, in Gatundu. And as they are walking back, they will pick the virus. So we decided, and we have made it as a policy, which we are building on, that those who will be attending the non-communicable diseases clinic, NCD clinics, the clinics will be brought as closer to the patients as possible. So we are now pushing more of NCD drugs to the rural areas, to level 2 and level 3. All we need is a medical personnel who monitors. And once it is dispensed, it is enough to last that person a month, and you don't have to go to the hospital. And
any more people, because we intend to intensify and start a mobile program for taking the vaccines to the people. And Governor, this is the first one that we are doing, introducing the mobile system of taking vaccines to the people. And to that extent, we are appealing to other county governments to do exactly the same. let us mobilize the vehicles that we have for other purposes. For now, let's mobilize this system so that we can reach the unreached as far as vaccination is concerned. We are happy about the association that we have developed. It's very important for our nation to know that we have got international partners who are working with us. But as Manisha said, it is not enough yet. We are appealing to the world community to start and to stop vaccine appetite, where some countries are vaccinating even children, while the rest of the world have not started vaccinating. Even the adults have not been vaccinated. And yet, when you look at the evidence and science that is there in front of our eyes, we do not see the necessity of intensifying children campaigns when other people elsewhere, because the fact remains that the geographical boundaries that we understand as the globe are irrelevant when it comes to virus transmission. Because the truth is that a person who is not vaccinated in Kenya can transmit the virus in Uganda and the UK and America and elsewhere. And as much as we have closed the borders, history has taught us, since time immemorial, the human being has never been stopped from going where they want. Borders alone will not stop them. So let's make sure that we create a world where we are safe as a globe. And the only way we are going to be safe is when everyone is safe, so that we can all be safe. It is important for us as Africans. We have an African saying that we eat together and we cry together when you are friends. But if you are not true friends, hao ni watu wale wanachanja watoto, alafu tukienda huko United Nations wanaanza kusema vile sisi ni marafiki. Sisi ni marafiki, wewe unachanja watoto ambao ni kitu napoteza vaccine, na sisi tunakufa, and we are friends. Ai? Jameni, huyo ni rafiki kweli? Kwa hivyo, I want to use this opportunity because it is important for us to voice these things. Otherwise, diplomatic niceties that produce nothing are useless as far as I'm concerned. Moving on, we expect in this country to have other vaccines as well. And in response to some of the issues that have been raised, I think, Gena, you raised the issue of the vaccine presence in our country. That first I want to say, to begin with, there is no vaccine that is going to expire, because we have got a force that ensures that that does not happen. We have got a cold chain that ensures that that does not happen. So we will not have any vaccines expiring. We are expecting to roll out the Pfizer vaccination next week as well, because some of the syringes that we have been waiting for, we are live on Saturday. We have already got 1 million of them in the Pfizer vaccines in the country, and indeed we are expecting more vaccines. So in terms of the acceptance of the vaccines, we have seen no discrimination. Yes, some people have been saying, can I get this one? Hata simusikia yule mama alikuwa hapa, sijui alijuaje iko Johnson & Johnson. Vile tunasema ni kwamba whether it's Johnson & Johnson or Moderna or whatever, like the very able community health worker explained here, it doesn't really make any difference. So whatever you can get, for example, today in this county we are using Moderna. Moderna, as you know, in fact was the first one that was used in the United States, and it is a very good vaccine. So let's use what we have. When the other ones come, we go for whatever we can get. At the end of the day, what we are really looking for is to ensure that our people are fully vaccinated. And in that process, we want to ask our institutions, and we are particularly thrilled with the work that our spiritual leadership is doing through, as you heard from Connie, they are very strong in terms of the management of this COVID COVID-19 through the interfaith kind of banana nation, as some would mistake. We are proud of ourselves, and when you do what you are doing through KEPSA, you make us even more proud. We are proud of what you do. We are proud of the Kenya Chamber of Commerce and the input they continue to give as far as the management of diseases across the country is concerned. Kimalizia hapo niseme hivi, sio tu mambo ya COVID ambayo tuko nayo katika nchi yetu ya Kenya. Tuko na mambo mengine sana sana, mambo ya malaria inaendelea kutusubua sana. Na sisi tungeuliza wale ambao wanafanya kazi, especially our very able community health workers, when you are dealing with COVID-19, na wale ambao wataenda nyumbani kwa watu kusaidia wazee, please take advantage of using the same transport kuzungumzia watu, kila mtu, mambo ambayo itamhusu juu ya afya yake, sio tu mambo ya COVID-19. We have got diabetes that is troubling our people, and we would like to ask the county governments to enhance the work of nutritionists so that as they go around the country, they can then talk to our people about nutrition and the way to avoid, because lifestyle diseases, cancer and so on are on the increase. Of the press, members of the media, mtusaidie sana about this issue of misinformation. Hii mambo ambao mlisikia hapa mama moja akisema, jana tulikuwa kule Naivasha na tukaongea hiyo maneno. Hii mambo ya kusema sijui itafanya hii, ukichanjwa itaenda namna hii, hutapata watoto. Na sisi tumeona wengine wamechanjwa, hata wakati wamechanjwa ndio wamepata twins. Sasa kwa hivyo tusije tukasema hiyo ni uongo. Mambo ya uongo tuache. So we move along with the vaccination area, and as we head for the holidays towards December, we want to make sure that the travel period does not resort to another wave of COVID-19. And that's why we are asking that those in the hotel sector, we should ensure that all the people working in a restaurant, working in a hotel, have already been vaccinated. Nchi zingine zimeanza amri ya kusema, if you want to book yourself into a hotel for Christmas, the hotel should ask you, are you vaccinated? If you are vaccinated, chukua booking. Kama ndio vaccinated, tafuta pahali pengine. Kwa sababu ukija hapa, then you are going to spread it to our waiters, you are going to spread it to our cooks, you are going to spread it to their children, and before you know it, we have a fifth wave. So we are asking, tukienda mbele, as we move on ahead, let's look at the institutions. As you know, we have saved our children because teachers have agreed to be vaccinated. That is how Kenya has opened schools. And the way we are going to open our economy is when we get more and more people being vaccinated. We can open the entire hotel sector. We can open all the bars. We can open all the pubs to the hours that legally they are supposed to operate. Because we can do so if people going into those pubs have been vaccinated, and therefore there is no spread. Na kama mjuavyo, watu wakiingia bar na diona kuwa na curfew. Watu wakiingia bar bila vaccinations, waingie huko waanze ile maneno ya kawaida. Na sio, na hiyo maneno mnaijua. Najua Koni hajui kwa sababu haingii huko. Lakini wale ambao wanaingia huko kama wewe na yule, tunajua ile maneno inaendelea huko, maana ni mahag, mala ni nini, mala wajua mtu akiwa mlevi hasikii kama watu wanamsikia. Anakunywa pombe, unaona anakaribia paka sasa ako hapa kwa uso tu, na ana shout very much, umesikia vile tumesema. Na sasa yeye ni mlevi kabisa, akiwa na COVID, akiwa na kwanza mask hata ajui alipeleka wapi saa hiyo. Kwa hivyo akiwa na COVID, mara moja mko tigoni na yeye. So my friends, if you want to continue, me, I've got no problem with you enjoying a few Kagwe specials. Lakini tafadhali, can you be vaccinated and then we can have a deal? You be vaccinated, endelea na zile specials. Lakini when you are not vaccinated, then you take it to the barman, to the waitress, nini, mambo kama hayo tunaharibu. So mine is an appeal. Though especially those people who are 50 years and above,